a show of hands to see how many of you actually do a boob check. And if you don't, why not? If you do, how frequently, and how comfortable do we feel about sharing that information that you're checking your own boobs? When you're menopausal or you're a woman in your 50s, in the UK, you'll get screened and you'll have mammograms. But how many of you check your vulvas and your vaginas? Now that's always a bit of a difficult one, isn't it? Because suddenly we all go a little bit squeamish, and some of the guidance that comes out is actually to photograph your vulva. I say this with a straight face because most of us would be like, not on your Nelly, not with a smartphone. That's another story. Okay, but actually this conversation is going to be all geared around any changes to the vagina or the vulva. We need to share this information and see a health specialist as soon as possible, particularly when it comes to the prolapse. So it might be something fairly subtle that has happened in your changes, where you go for a bowel movement and suddenly it's a bit uncomfortable and you feel like there's a bit of a lump down there. It's fairly common. It's way more common than you think about. But pelvic organ prolapses are something that over a period of time will deteriorate unless you get the right support, but you have to seek advice from your doctor. And they'll talk to you about what you can do to support it should there be a prolapse in place. Now, firstly, what is it? So we know there are several types of prolapse, and it starts with maybe the back wall is weakened. It happens for several reasons. It might be that you've lifted heavy weights and it's caused the walls to descend. It may be through childbirth, big babies, fast deliveries. It's always and often related, not always, but it's often related to the deficiency of estrogen in her body. And there will maybe other interventions that may have arisen. Okay, so that's kind of it. But what does it look like and what happens? Well, for a start, if there is a back wall, so a rectocele prolapse, sometimes that affects bowel movements, constipation, and often women will report to insert fingers through the vagina and press back against the bowel wall so you can fully evacuate. That would be one example. Another example, when it's the back wall, is that sometimes there's loss of function and suddenly when you've got to go, you've got to go. But here's the thing, it's really important to talk about this because often we don't know. We just think this is all part of getting older. It might be, but actually in many cases it can be addressed. Whether that's through some pelvic floor exercises and some quality training around pelvic health, or in some cases going on to have a surgical repair. There's also things like pessaries that you can insert. I did that circle shape then. Pessaries that you can insert into the vagina to keep the vaginal wall upright. But it's not just the back wall, there's also the front wall. And that can sometimes have an impact on the bladder and cause bladder weakness and the bladder to descend as well. All of this can be confirmed if you go and see your GP. You'll get referred off, they'll do a CT scan or they'll just check. And quite honestly, in most cases, your health professional will be able to feel if there's any weaknesses or any prolapses. But it is important to talk about it and get it checked. Now, so let's assume, so in my case, I had a back wall prolapse repair in my 30s and then again in my mid-40s, late 40s. And I put both of them back to very large babies and very fast aggressive deliveries for both of my children, in spite of being a Pilates teacher, in spite of lifting heavy weights and knowing my breathing techniques and how to strengthen my pelvic floors. I still struggled around the mass that was starting to descend, and a lot of that, particularly in my 40s, was to do with the estrogen decline. Okay, so, and to start with, for me, really focused on my pelvic floor exercises, a pelvic floor physiotherapist or a woman's health physio that gave me lots of support, still wasn't enough. So now we're starting to think about maybe inserting a ring pessary just to help lift the wall up, because I was finding that I was becoming stress incontinent, and I would just pass wee whenever I felt like it. It's more of a, it just happened a lot, particularly things like when I was sat down and then go to rise and stand and have a little wee. I'm sharing this personally because I think it's important that, you know, this is a lot of lived experience as well as good knowledge and training from the iCare Move team. But anyway, and the last stage is where, you know, you're not coping for whatever reason with the prolapses, and it's uncomfortable, uncomfortable sitting, uncomfortable exercising. I mean, it gets to the point where actually sometimes a surgical intervention is the only way forward, and that was the case for me. So you can have multiple prolapses. There might be a back and a front wall, or a front wall and a bladder. It depends. You are unique, and we don't know your story, but there may be more than one thing going on here. And it's often the case of we don't know until you're asleep and they have a little rummage and figure out what is best practice to be able for you to move forward. But also, we have to take into factors such as that could lead on to a hysterectomy. So it might be that the tissue viability isn't strong enough to sustain having a repair. So the next option would be to take part of the womb away, or the uterus, or the whole thing and the ovaries. It really is it does vary. And it also varies to do with your family history. It might be that many of the women in your family may have struggled with prolapses themselves, so there might be a link. It might be as you get older, it gets worse, and we need to have a look at it. But also things like you may have had a hysterectomy and the prolapse has happened since then. But you know what? You keep doing those exercises, and we talk about pelvic floors, Kegel exercises, good muscle tone to strengthen your pelvic area. Maintaining a healthy weight really helps as well, and to avoid constipation. And it's, you know, when you go for a poo in the morning or whenever you regularly go, it is really useful to sit forward and almost rest your chest towards your knees and prop your feet up on higher blocks either side of the toilet. So you're kind of leaning into more of a squat position, so you don't have to push or press, and naturally it's the most comfortable way for you to have a bowel movement. So this is all exciting stuff. Smoking can affect your health as well, your pelvic floor health, because it affects at a cellular level. And of course, we've just come out of COVID, the chronic cough. So cough, 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 cough. Eventually, your pelvic floor will just go, done, I've had enough. And that's important to understand as well. So if you are already conscious of pelvic floor, it's not feeling like it used to, there might be a bit of back pain, there might be something that's just not quite right, please, please, please go and get checked out. And if you think there is something not right going on there and your undercarriage feels uncomfortable, be careful with your back, and be careful when you're lifting heavy weights as well, because that will ultimately take its toll unless you know what you're doing and you've got a lot of support behind you. But even then, you've got to look after your longevity. So you might want to lift heavy weights, but actually risk versus reward, it might be more important that you just look after your health rather than try and lift heavier and heavier weights. So it's just like a bit of a touch around the subject of pelvic health. and hopefully it's a bit of a reminder for you to check your vagina, make sure it feels comfortable, check the vulval area as well, so we're making sure there's no lumps and bumps, anything untoward that's going on, and you know, in all seriousness, if you want to photograph and sort of track any changes, feel free to do that, but be careful with your safety of your phone. And then finally, it's around sharing and caring. So if something doesn't feel right, don't feel embarrassed. We've all got, all us girls, you know, we're very familiar. We know what to do. Have a chat, ask a question. And if you want further information, so we can go into a deeper dive around this subject, because we are going to talk about hysterectomies, I'm totally up for that conversation. So get in touch. I'm Helen from I Care I Move. This is a video around prolapsing. Just be conscious of what's going on downstairs. And I'll speak to you soon. Take care.